Today in the New Haven Register, there was a report done talking about the analysis that was done in East Haven, saying that it shows that the police department disproportionately does enforcement against people with Hispanic names versus people of other races. We have a situation in Arizona where there's very, very, what I consider unconstitutional, strict law enforcement against immigrants. New Haven is well known for its immigrant population. What are your opinions on illegal immigration, specifically immigration reform, and what are your views about this anti-immigrant sentiment that's going on across this country?
Well, the anti-immigrant sentiment is not only across this country, it's across the world. It's happening everywhere. But, well, first of all, and I did read the Register this morning. I think the situation is outrageous. I really do. But Arizona is moving. Other states are moving because there isn't a federal policy. I understand states are trying to do something, and you like or not like or anything, but they're doing something because in the absence of a national policy. We need a national immigration policy. We need strict enforcement at borders. And real enforcement at the borders. We also need to clamp down on employers. Employers who hire folks and do it because they figure they can pay them less. They don't have to pay any benefits, and they hold them captive. That is a very, very big issue. And we have to be serious about that effort. We have to, those people who are here illegally, who have committed crimes, ought to be deported. They ought to go. We need to find a way to a citizenship that says to people that you have to pay taxes or back taxes, you know, with a whole lot of criteria as to what they ought to be doing. And then in terms of citizenship, they can't preempt those who have been here seeking citizenship who have come in legally. In essence, they do go to the back of the line and do that. But you've got to have some sort of a national policy, otherwise you are going to have a checkerboard around the country. And it's almost, you know, they're struggling with an issue, and I was happy to hear Harry Reid say that he was, you know, he wanted to move on this issue. The president has said so. I am not sure that there will be movement on this before the November elections. I just say that. But
in a quick follow-up, a lot of people that I talk to are a little disappointed in the Democrats in terms of the health care issue. You had the allowance of Republicans and people on the far right, the Tea Party movement, say stuff like death panels, health care for illegal immigrants. Things are just outright lies that just continue to this day. And that was allowed a lot throughout the entire health care process.
It was demonized. The bill was demonized.
But there wasn't enough offense upon people, supporters of health care, to say, look, these are lies, and educate the people about these things.
We did some trying. I will agree with you and disagree with you on this, and we had this conversation a minute ago. It was hard to get any word out about what was, you know, what was good. But I would just say this too: there wasn't the kind of pushback on some of these issues that there should have been early on to dispel the notion that there was never any death panels, and there was never going to be that anybody who was here illegally was going to have access to health care. It was clearly written, and there should have been more if you will, of a pushback in terms of some of those areas. I would concur with you, but I would also tell you that in terms of trying to talk about the substance of this piece of legislation, it was tough to try to get any kind of word out about what was actually in, you know, in the bill, and that people didn't believe it. People wouldn't believe you because they had been so in your look. And I also think the insurance companies did as much as they could to demonize the bill. I think that they played a big role in this.
Just to branch up the health care real quick, I just wanted to finish. In terms of immigration, we know it's more of it's just as emotional as healthcare. You know, it's going to be a lot of lies coming from the far right about things about immigration reform. what can you say to constituents that are a little disappointed, disheartened about Democrats to say, look, they're going to push not only to fight for immigration reform, but to push back against the lies that you know are going to come from groups like FAIR, the John Birch Society, anti-immigrant organizations here in New Haven?
Unless you really do it, they're not going to believe that you're going to do it. So I think you have to be engaged in fighting back. You know, again, I did office hours this morning. People come and they, you know, you know, even if you tell them that there's something that is in it, they look at you skeptically. You know, no, it's not really there. I said, it is. It really is there. You know, it got to be a little more difficult with, and it could very well be the same. You know, at one time there were 5 health care bills. Then there were 3 health care bills from the 3 committees. Then there were, in the House there were 3, in the Senate there were 2, and then we passed a bill in the House, and then the Senate took 2, came down to 1. So all of that time in which to do that, where something wasn't definitive, it was, you couldn't stand for sure and say, this is it. Now on health, this is it. This is what's there and what isn't there. And there will be, as you say, a lot of, there will be a lot of lies, there will be a lot of emotion, and there will be, in any debate on immigration. And believe me, I can tell some people today that anyone who is here illegally is not going to be able to avail themselves of health care. They will look me right back in the eye and say, that's not true. You know, so we have to continue to do it and do it and do it. And you hope that it gets through in some way.
This leads nicely into the question that I wanted